Thank you, Chairman. Hello, colleagues. It's a great honor to be our first speaker on this session. I am Motofumi Suzuki, a virologist from the University of Tokyo, Japan. Today, my topic is a nationwide survey of continence status among special elderly nursing home residents in Japan. Special nursing home is a facility where the frail elderly persons live in throughout their last phase of life. This is my disclosure statement. I have no conflict of interest for this presentation. This slide shows change of aging rate in the past and the future. Aging rate is proportion of the elderly persons aged 65 or older. As you can see, it is rapidly increasing worldwide. The red heavy line indicates the situation of Japan. Since 2007, the aging rate in Japan became above 21%. So the situation of Japan has been a super aged society for 12 years. Nowadays, it is above 28%. I think urinary incontinence and fecal incontinence are one aspect of aging society because they are highly prevalent condition among the frail elderly. In this study, we conducted a nationwide survey to investigate the prevalence of urinary, anal, and double incontinence in the elderly aged 65 or older living in Japanese special elderly nursing homes nationwide. And we tried to identify the associated risk factors. Number of study participants was approximately 4,500. Mean age was 87 years old, and mean care needs level was 3.9. This is a Venn diagram which indicates the continence status of the participants. In our cohort, prevalence of urinary, fecal, double incontinence was 83%, 70%, and 66%, respectively. On the other hand, continence rate was only 12%. We tried to review risk factors of incontinence by using a logistic regression analysis. As for urinary incontinence, age, impaired short memory, decrease of Barthel index, and gain of dietary calorie were risk factors of urinary incontinence. As for fecal incontinence, impaired short memory, decrease of Barthel index, decrease of fluid intake, and gain of dietary calorie were risk factors of fecal incontinence. Risk factors of double incontinence was as same as a fecal incontinence. In summary, approximately 2/3 of elderly participants have double incontinence. And decrease of Barthel index and impairment of short memory were common risk factors for all types of incontinence. Gain of dietary calorie was also a risk factor of any types of incontinence. However, magnitude of effect was low. But lacking serum albumin and total protein levels and body mass index are limitation of our study. I think experts of urinary and gastrointestinal tract should deepen their understandings and share them each other, gathering wisdom to improve continence status, activity of daily living, and quality of life of the frail elderly through a transdisciplinary approach is crucial in this globally aging society. Thank you for your attention.
Open for question.
Hi, Alex Berger from San Diego, California.
Hi.
Excellent study. Curious how these patients ended up in the home itself. So I imagine these are folks who are fairly sick, have other comorbidities. other limitations, particularly neurologic limitations that may make them more susceptible to these symptoms? And I'm also curious if there's been studies in your country on patients who aren't in these type of facilities who are aging at home, if there's a difference.
Thank you for a nice question. In Japan, there are two kinds of nursing homes. Ordinary nursing home is a facility to provide rehabilitation to back them to home. But special nursing home is end-stage home. So the very high comorbidities and the ability of living is ADL is very low. So the prevalence is very high in my cohort. Is it okay?
Thank you. Second question.
Hello, my name is Caroline. I'm from Queen Square, London. Thank you very much for an interesting presentation. You mentioned that a risk factor is impairment of short-term memory, and I should imagine that that needs a little bit of unpacking to understand precisely what's going on there. But I just wondered, in terms of a sort of rehabilitation technique, has anybody tried sort of timed avoiding reminders, etc.? Is that useful?
Oh, thank you. In the nursing homes, caregivers ask the elderly, do you feel urinary sensation or not? Every 2 to 3 hours. Yeah.
Thank you very much. I think we will go for the next presentation. Thank you.
Thank you very much.